Facial aging. It's one of the most common consults I see in my practice. And with facial aging, there are a number of things that happen. And people come in interested in face and neck lift surgery. And so when you look at people as we age, there are a number of things that happen. We lose elasticity in our skin, so we lose collagen and we lose elastin. We lose the thickness of our skin, and that can be from a combination of aging, that can be from sun exposure. If you look at some of the deeper structures of the face, we lose volume, so there are bony changes. So as people age, we lose bone density, and I always tell my patients, an 80-year-old is more likely to break their hip than a 20-year-old. And we lose fatty volume, and that loss of fat in the face is kind of one of the most underappreciated aspects of facial aging. And so if you look at patients as we age, if you draw a line down the center axis of someone's face, all of the soft tissue falls down around that, and the jawline becomes more rectangular as we age. It loses that nice angular appearance. And so when you look at trying to do facelift surgery, you want to try to recreate that angular appearance that patients had in youth. Now, with the face, it's more than just tightening skin. And I think conceptually, when people think about a face or a neck lift surgery, they think about it as just a skin tightening operation. But skin doesn't have a lot of strength. And so as people age, you have to tighten up the structural parts of the face. And if you look at someone's face, there's a muscle called the platysmal muscle, and that muscle goes from here, and then it continues up into the face as what's called the SMAS. And the SMAS is basically the fascial extension of that platysmal muscle. And so when you do face and neck lift surgery, it's very important to elevate up the SMAS and elevate up the platysma. Now, depending on how saggy someone is, you can do that to different degrees, but structurally that's one of the most important parts of this operation. And I always tell patients, facelifts are like building a house. You don't put a roof on without a frame, and the frame of the face is the platysma and the SMAS. And so you have to elevate that and put it up into a higher location, and then you elevate the skin and you redrape it so that you have a healthy, natural, refreshed look. No one wants to look like they kind of quote unquote had a facelift. And I always tell my patients that well done facelifts look healthy, they look natural. People can't pick that out. We can all pick out very bad facelifts, and I don't want those to be my patients. So when you do facelifts, there are different versions of that. There are facelifts that I do in the office, what I call an in-office facelift, and there are facelifts that I do in the operating room. If you look at a patient like this, she had an in-office facelift, and she's a great candidate for it. She has mainly some skin laxity, and she has a little bit of platysmal banding. She doesn't have a lot of extra fat in the face or the neck, and you can see that laxity in there. And so if you have a patient that is thinner, has more laxity, good patient to do in the office. And when we do an in-office facelift, we give people Valium. You are awake. So you do feel some numbing shots, and then we use what's called a tumescent solution to inject in the subcutaneous tissue. But it's a procedure we do in the office, totally awake with Valium on board, and people do remarkably well. And I do about 120 to 130 facelifts a year. About half the facelifts I do in the office, about half the facelifts I do in the operating room. Now, if I show you this next patient, this is a patient that I would do in the operating room. This is a patient that I did a face and neck lift in the operating room, and you can see with this patient there's a lot of extra fat and tissue in the neck. And this is not an operation that I can do in the office. In order to go from there to there, you have to do a lot to undermine all that tissue, take the fat pad out in the middle, and resuspend that muscle. And so this operation is very different than the facelift that I would do in the operating room. And I always tell my patients, a facelift is not a facelift is not a facelift. And so you look at each patient, you look at their troubled area, you try to tailor their operation to their kind of desires, needs, and their anatomy more specifically. And if you have to do a lot more undermining, a lot more tightening of the muscle, that's something that you're going to do in the operating room. So almost every facelift that I do fat grafting. And I think fat grafting has taken our results from what were good results to great results, because as we age, we lose that volume in our face. And if you look at the back of a hand of a baby, a 20-year-old, a 50-year-old, and a 90-year-old, as you age, you lose that fatty volume. And trying to restore some of that volume back in the face when done tastefully looks really, really nice. And so if you look at a patient like this, she had a face and a neck lift and she had some fat grafting. So when you look at a patient like this, you can see that she's lost a lot of volume, up in her malar eminence. And this is one of the main areas that we tend to do fat grafting. And if you look from the side, you can see kind of how hollowed out she is right here. And if you look from this direction, you can really see that. And so when I do fat grafting, one of the main areas that I'm focusing on is this cheek area, to try to build that up, because face and neck lift surgery doesn't restore that. It tightens the structural parts of the face kind of in the outer 2/3. It doesn't add that volume back in the inner third of the face that we lose with facial aging. And there are some patients that I also do some fat grafting into the nasolabial fold, into the medial fold, into the chin, and occasionally I do some fat grafting into the lips. You don't want to overdo fat grafting in the lips, otherwise you look kind of funny, but adding volume back into the face looks very, very good. And with fat grafting, when you're doing it, you're putting it in very small amounts. So you use these very small cannulas. There are not incisions for it. There's just a little poke with a needle, and you layer that fat in the face, and you're putting small aliquots so that blood supply grows into that fat cell, and the fat cell can live permanently. And if you look at most of the studies, about 50 to 70% of the fat that you transfer will live long term. And so there is some degree of permanent volume enhancement with fat grafting. So with facelifts, there are scars. You can't do it without scars. The key is being very strategic in where you place those scars. And when you're doing that, you're typically placing that scar up into the hair, and then I try to go kind of right in front of the ear or inside of the ear. And then if you look at this patient, you can see how she has an attached earlobe and how I recreated an earlobe. Again, the goal with facelift surgery is to try to hide that scar as much as possible. Now, your hairdresser, yes, they're going to dig around behind your ear, they're going to see that scar, but you don't want the lay public seeing that scar. And again, the goal is to look healthy and refreshed and natural, and you want to be able to hide those scars as much as possible. Recovery from facelifts is important because obviously it's your face and you can't hide it from the public in general. And so when you do facelift surgery, the surgery, depending on whether or not you're doing surgery on the eyes or the brow, can be anywhere from 2 hours to 4 hours. It's outpatient surgery. When I do the facelift surgery, most of the time I use a drain, and the drain goes back behind the ear. And we see people back 2 days in a row after surgery. The first day we take the head wrap off. The second day we see you back, we take the drain out. The stitches are usually in about a week to a week and a half. The first week, I always tell all my patients, you're socially unacceptable. So, you kind of got to hide out as much as possible. By the end of the second week, you're usually doing pretty well. You're still going to be swollen, particularly if you have fat grafting. And that takes about 6 weeks to kind of fully settle out. And then the scars, take a year to fully mature, but most people will end up being able to go back to work after about 2 weeks. So risks of facelift surgery. Nerve injury. So 1% of facelifts can have a nerve injury. Now, most of those nerve injuries are temporary and they will get better over time, but there's a very small percentage of people that could have a nerve injury. I do a lot of facelifts. I know this anatomy backwards and forwards, but even in the best of hands, you could have a nerve injury. The most commonly injured nerves are a nerve that go to the earlobe called the great auricular nerve, and then a nerve that goes to the depressor of the lower lip. Again, most of those things get better over time, but they are a risk associated with the surgery. Bleeding. 2 to 7% of facelifts can have bleeding. In women, it's about 2 to 4%. In men, it's up to about 7%. And so it's very important to keep your heart rate down, your blood pressure down with facelift surgery. And I don't want you doing anything strenuous the first 2 weeks. Numbness. When you do the facelift surgery and you lift this tissue up and you bring it up, you will have an area of numbness in your cheek and down in your neck. Now, it tends to be a bigger issue for men when they're shaving, not as much for women, and that does get better, but you could be left with some numbness, especially right in front of the ear. asymmetry. Not everyone's face is asymmetric, and depending on how you sleep, if you sleep on the right side of your face and you're squishing your face all night, you're gonna be different on the right versus the left. And so we try to make things as symmetric as possible, but there's no perfectly symmetric result with the surgery. And then the scars, you have those scars. The scars take a while to heal, but usually after about 6 weeks, they're looking pretty darn good. General risks of an anesthetic, nausea, vomiting. That's 1 in 4 people, and then just dissatisfaction with the surgery. My patients are incredibly happy with this surgery. I don't like operating on people unless I feel I can get them a result that they're going to be happy with, that looks natural and youthful.